Hello, I'm Andrea Bogner. I'm an athletic training student at the University of Idaho, and I'm going to talk about athletic training today. Just a little bit about me. I am originally from Norfolk, Nebraska. I attended the University of South Dakota and received my bachelor's in health sciences. Now I'm at the University of Idaho, where I'm getting my master's of science in athletic training. One of the reasons I chose Idaho was because I was able to do my clinicals in a variety of locations across the U.S. As you can see, I was in Texas, Tennessee, and then now I'm back at Nebraska. Why I went into athletic training: it's a mix of health concentrations and sports. So you have that rehabilitation, which is like PT, you have some emergency medicine, which is like an EMS, and then general medicine, so like a doctor, PA, nursing, and then orthopedics. And I just really like that it all combined those together. And then it's also constantly changing and growing in education. There's always more stuff to learn, and it's continuing to improve. And then every day is different. Practices are consistent, but you never know what you're going to see that day or who's coming in. So variety. A lot of what people think we do is tape ankles and tape other injuries, but we do so much more than that. What do ATs do? We do prevention and health promotion. So we work with our athletes to make sure they're taking care of themselves and to help them prevent getting injured when they're on the field or court. We do clinical examination and diagnosis of orthopedic injuries. So we look at them, we test how things are, and then we can diagnose with injuries. So like ankle sprains and ACL injuries, shoulders, a lot of stuff. And then acute care of injuries and illnesses. So what do you first do when you have an ankle sprain or a concussion? Or sometimes some of them are even more emergency related, where you have to send them off to the hospital or ER. We do modalities, which would be like ultrasound or electrical stimulation. So ultrasound, just kind of sound waves, and then electrical stim is just kind of like a TENS unit. Like if you're in athletics, they put it on you and your muscles kind of vibrate. Rehabilitation, so just like an exercise program that we give them to help them recover from an injury. We work with psychosocial strategies and referral. A lot of athletes go through some stress when they are injured and frustration when they can't get back to play as soon as they want to. So we work with them mental health wise, or we can refer them on to somebody else who's more prepared for that than we are. We also do healthcare administration, so a lot of paperwork. We don't like it, but we still have to do it. And then our path has opened up from athletes to more than that. So we do work in a variety of settings where we have to work with insurances. Professional development and responsibility. So that would be doing our continuing education units and continually learning. So we are giving the best, most up-to-date information for our athletes. And then education. So 2 types of that, kind of like what I'm doing now, describing what I do. And then also working with students to become athletic trainers, so like teachers. A lot of people confuse athletic trainers with personal trainers, so I just have a quick little something that describes the difference between the two. Athletic trainers, it is actually now a 6-year program, so you have to get a master's in it. We take a comprehensive exam so we can become certified. We have governing organizations to make sure everything is up to date and that we are practicing the best we can. And then we also have a national association to make sure we are following our code of ethics. And then our daily duties, we do physical medicine and rehab services, prevent, diagnose, treat, and rehabilitate injuries, so ankle sprains or just back pain. We coordinate with physicians and other healthcare professionals, and we work in a variety of places. And then personal trainer, a lot of them is just a certification. That's not necessarily required, though, to work as one. They may not have a higher education degree, and they can be certified by a number of organizations. And their daily duties are more fitness, exercise, to improve strength and agility is what it's more emphasized as in athletic training. We do it as a rehabilitation. So personal trainers work with more fitness goals, and then they also talk about the education of physical activity, and they work in health clubs, wellness centers, and places like that. And then athletic trainers, we are in the center of everything. We do a lot of communications between PTs, chiropractors, and physicians, strength and conditioning staff, coaches and officials, and then athletes and their parents if they are considered a minor. We do a lot with both physicians and strength and conditioning. Usually a lot of places have strength and conditioning on site, so we have that, and then physicians on and off. You always have to talk to the coaches about practices, student or athletes who aren't going to be able to be practiced due to injury or what they can or cannot do during practice. Officials only during like games, and then always you have to be in communication with your athletes. And then, like I said, if they're minors, you do have to talk to their parents a lot as well. Just a little bit about our education. It is a 2 years master degree, so a total of 6 years for bachelor's and master's. And then we just kind of go over evaluation and diagnosis of injuries and illnesses, CPR and AED use. There's a lot of anatomy, rehab, modalities, general medicine and pharmacology. Just a little bit of that. We can't always diagnose it, but we need to know enough to be able to like, okay, you're okay, this is just a cold, or no, you need to go see a doctor. Psychology and neuroscience, so how the brain works, and that. Ethics is very important in athletic training and all health careers. And then we do actually do research. Yes, and as you can see, there's all of my books I have for this, for my 2 years. Employment opportunities. We have educational institutes, so you have your middle schools, high schools, colleges, universities, and then professional sports and amateur sports. A lot of people don't know. We also do hospitals and clinics. Some of us are employed as in orthopedic clinics, and we do some rehabs there, or PT clinics as also. There's corporate workplaces, so we work with like people who do industrial lines, and how they stand and everything, and make sure they're standing properly so they can avoid injury. We also work with military, in police and fire departments, and performing arts. And personally, I think performing arts is probably one of the most coolest places you can work, because they just have to work so hard in their ability to just hold a muscle and like stay there while doing it, rather than other sports are more explosive. Performing arts is purely control, and I think that's just really cool. Pros and cons about working athletic training. Pros, no day is the same. You get to work in sports, and I love it, working with athletes in that atmosphere. It's just very fun. You get a variety of areas. Like I said earlier, there's so many places I can work. And then adaptability. I just love the changing of it and the inconsistency, I guess, of it. Cons, schedules. You work evening, weekends, and holidays, as well as days. So if you work an evening, you probably also work that day. Yes, you work holidays. Everyone loves watching football games on Thanksgiving. We have to be there too, and then we actually do get a low salary, which we are working towards to fix. We think we are important for all schools, and that we are working to trying to get us an equal pay. Schools in the area, so Nebraska, South Dakota, Iowa, Midland University, University of Nebraska at Kearney and Omaha. And then in South Dakota, we have South Dakota State University, Dakota Wesleyan, and Augustana University. Iowa, Iowa State Northwestern College, University of Idaho, and University of Northern Idaho. There are more in the areas, but I just picked a few. So if you ever want to see more, you can go to this website here, and under program you put professional and degree type masters, and then you can choose your state, and it will give you a list of all that have accredited programs. If you want to be an AT, athletic trainer, this is something you should do. There's important things that you need. Undergrad can be anything. Most are health related. I was health sciences when I went in, but a lot of people I have gone to, one was previously, he was a cop, so not very health science. So a few people are psychology, just a variety of things that we have had. Communication skills, you talk to a lot of people, you need to be able to build rapport and work with them. Adaptability, everything's changing constantly, you need to be able to go with the flow. Job shadowing is important. Go job shadow in your high schools in a variety of areas. And if you want a job shadow, you can always contact Northern Nebraska AHEC, and they can help you set that up. And then just classes, anatomy and physiology is huge. Statistics is important too, because you also do a lot of research. And then science classes, your biology, physics, and chemistry. Injuries. So I'm going to show you a few pictures of injuries that we have worked with. I personally haven't, but athletic trainers have. Some of them, they're not gruesome, but if you don't like blood and seeing weird things, this is probably not for you. So fractures and dislocations. So this first one, I believe, is gymnast. You can see his leg is bent at a not normal angle. So fracture, it's not coming out of the skin or anything, but you have to deal with these emergencies. And then same thing with the soccer player. His foot is twisted backwards. So it's very important at games that you have emergency protocols set in place and you have ambulances, because in both instances these guys would have been put in splints and sent off to the hospital immediately. This one is the same thing, but with an arm. You can see that the elbow is sticking out. I'm not sure if this is a fracture or a dislocation, where the humerus can be out here and then the hum is out, and then that bump that you see at the bottom middle part of the picture is the elbow. Again, splint sent to the ER. These are two different pictures. So this first one is just a facial laceration. What we do is we just have to clean up the blood depending on how bad it is. We have to put like steri strips or other sealants on to keep it from bleeding, and then clean that up before they have to go back to play. This other one is a shoulder. You can see the second picture is the shoulder. You can see that the shoulder, the humerus, is dropped down, and you can kind of see the top of the shoulder and then the bottom of the shoulder. And that is just a dislocation. So again, splint or like hold tight to the body and then sent to the ER for relocation. And that is the end. So these are some websites or extra information and references. NATA is the National Athletic Training Association. That is our governing body. And then everything else is just more information about us. I've also attached these onto a separate document, so you can always use that to go to them, and it gives a little more explanation about them.